So, good evening, everyone. Good evening, doctors. Good evening, Dr. Medicine. Do your duty, everyone. Good evening. So, am I audible and visible to everyone? Let me check. Everything fine? Yes, hello, FMG 2022. So, am I audible and visible to everyone? Okay. So, in this 1.5 or 2 or whatever, let us see how much time we can discuss. But I will try to cover every aspect for your FMG examination. Okay, not only the MCQ but also the topic, because they are not repeating MCQ, but lot of topics they are repeating. So let me discuss. Without further ado, let me start the discussion. Okay, so which is correct about malignant hyperthermia in adults? Increase calcium transport via L type of calcium, increase calcium transport via T type calcium, decrease calcium via L or T type. So everyone knows that malignant hyperthermia is due to mutation of ryanodine receptor, which is actually the L type of calcium channel. So if you remember that we have discussed in the excitation contraction coupling, this is your T tubule. What is this? T tubule. T tubules are invagination of sarcolemma. They are nothing, they are invagination of sarcolemma. And they have which receptor, doctor? They have a dihydropyridine receptor or DHPR. And ryanodine receptor is present on the L tubule or sarcoplasmic reticulum, in which calciums are inside this with the help of the protein called as calciquestin. So when action potential come, calcium will be released like this. And when there is mutation of this ryanodine receptor, this is a variety of L type of calcium channel, there will be more and more calcium causing more and more muscle contraction, and this will increase the body temperature, and that is called as hyperthermia, not fever. Mind it, fever, we use the word fever only when set point of the hypothalamus is affected. Only when set point of the hypothalamus is affected, we say fever. Here, suppose that you are dancing, you are exercising. Yes, video will be available after the class also. Sure. So that is not the fever. If you are dancing for 1 hour, suppose that there is excessive muscle contraction, temperature rises, that is malignant hyperthermia, not fever. So this is mutation of L type of calcium channel, and this is ryanodine receptor. This is called as malignant hyperthermia, doctor. Now sometimes they ask you in anesthesia that what are the various inhalation anesthetic agent that can cause malignant hypothermia. So one is halothane. Administration of the halothane and succinylcholine can trigger or exaggerate malignant hypothermia. And remember, when there is a fever, we give paracetamol so that temperature can come down. But paracetamol is a prostaglandin inhibitor. It will not work in hyperthermia. For that, we will be using dantrolene. So dantrolene is an effective therapeutic agent because it will block the T tubule and sarcoplasmic reticulum excitation contraction coupling. Okay, so thus interrupting this excitation contraction coupling, you can treat malignant hyperthermia. Now, which of the following ion plays a role in exocytosis? Sodium, potassium. Now tell me, doctors, whenever potassium come, what should come in your mind? Potassium responsible for RMP. Never forget, whenever potassium come, potassium efflux is important for RMP, and whenever there is hyperkalemia, it decreases RMP, and whenever there is hypokalemia, it increases RMP. So potassium responsible for generation of RMP, sodium responsible for depolarization, and calcium has so many activity. One is exocytosis. Let me discuss. It act as a secondary messenger. It act like a secondary messenger to what? GS, GI or GQ? So you must remember calcium is the secondary messenger of GQ, or we can say IP3 diacylglycerol. Point number one, calcium is the secondary messenger for GQ receptor or IP3 DAG. It also help in blood coagulation. Function number two, it help in muscle contraction. We know that when calcium attaches to troponin C, it causes conformational change and actin myosin bind. It help in muscle contraction. And the fourth, it is important for exocytosis, and also it establishes the nerve and membrane stability. It is responsible for the stability of the nerve and the membrane. So, which of the following ion play a role in exocytosis? Answer is calcium. Okay. Now, what about magnesium? Who will say? Who will say? Who will tell me what is the main role of magnesium? The main role of magnesium is to release parathormone. The main role of magnesium is to release parathormone, which maintain free calcium, which maintains free calcium. Okay, that is why hypomagnesemia can also cause tetany. So, what are the causes of tetany, doctors? Number one is hypocalcemia, number two is hypomagnesemia, and number three is metabolic alkalosis. So, which of the following ion play in exocytosis? It is calcium. Now, next question. Yes, Krishna Kumar, you are correct. Dense bodies are found in the smooth muscles at which of the following sites? Who will tell me the answer? A band, Z line, M line, or H band? What is the correct answer? Dense bodies are found in smooth muscles. So one point is clear. Dense bodies is not in the skeletal muscle. It is in the smooth muscle. In place of what? In place of what? Answer is yes, please. H H band. No. Yes, very good, Aditya. Answer is Z line. Z line. See, let me tell you. Let me tell you. Smooth muscles is anatomically different from the skeletal is that they lack visible cross striation. Point number one. All point which are differentiating skeletal from smooth is very important. The first point is that they lack visible cross striation. Point number two, actin and myosin are present just like skeletal muscle, but instead of Z line is in the skeletal muscle. So instead of Z line, dense bodies in the cytoplasm are giving stability to the actin filament with the alpha actinin. So remember that in the spoon muscles, they don't have Z line. In place of Z line, they are having what? They are having dense bodies. So dense bodies are giving stability to the actin filament. Okay, and they also contain tropomyosin, but troponin is absent. So what is present in place of troponin, doctor? It is calmodulin. So in smooth muscles, calcium bind with calmodulin, not with the troponin. Next question. There are two types of smooth muscles. One is multi-unit, another is unitary. What is the main important point? In unitary, they are having gap junction. So the smooth muscles who are unitary, they behave like one unit, they have gap junctions. Next question. Which of the following is not a molecular motor? Which of the following is not a molecular motor? Dynein, kinesin, myosin, or actin? See, three are molecular motor. One you have to rule out. Yes, what is your answer, doctor? Dynein, kinesin, myosin, or actin? Which is not molecular motor? Dynein, A. A is for reverse motility. You know that. Question is which is not a molecular motor? Sujit Kumar Pandey, A. Krishna. So a lot of people are saying dynein. Remember that there are three molecular motor. Remember there are three. Number one molecular motor is kinesin. Kinesin tend to move the cargo towards the positive end. Dynein moves the cargo towards the negative end. And myosin is also moving the actin. So myosin is a molecular motor, but not the actin, doctor. So remember the molecular motors are number one kinesin. Kinesin is moving toward the positive end, okay, and dynein is moving toward the negative end, while myosin is moving. This is the myosin, and these are the actin. So they are moving the actin together, close. So actin can be moved closer. That is why myosin is also the molecular motor. So answer is actin. Remember, dynein, kinesin, and myosin. These are molecular motor, but actin is not considered as molecular motor. Next question. Which is correct about the function of antiporter? Antiporter के लिए क्या सही है डॉक्टर? Is it secondary active transporter or primary active, or is it passive transporter? Both moleculars goes in, one molecular goes in and other goes out. The name itself is suggesting the answer. Antiporter. For example, if you remember in your DCT, there are channel which releases calcium but cause influx of sodium. This is called as sodium calcium exchanger. Yes or no? In antiporter, one molecule goes in and other molecule goes out. This is called as antiporter. Like all the exchanger, like sodium calcium exchanger, okay, like sodium proton exchanger, all the exchanger, these all called as antiporter. So this is a variety of secondary active transport. So this is the active transporter, but antiporter. On the other hand, if you talk about the symporter, they are like SGLT, sodium glucose transporter. SGLT is the symporter because both are moving in the same direction. So they are called as symporter. On the other hand, sodium calcium exchanger, all these are antiporter. Okay. Now the next question, doctor. Which of the following is true about SGLT1? There are two SGLT, SGLT1 and 2. Secondary active transport of glucose in the brain, in the intestine, in prostate, or in the rods and cones. Just now we have discussed that SGLT is a type of secondary active transporter. But my question is that SGLT is causing reabsorption of glucose in the brain, in the intestine. See, one question in FMG is for sure regarding GLUT or SGLT. One or two questions are coming every year. Yes, very good, very good. Answer is B. Very good. So you must remember at least there are two types of glucose transport. One is secondary active transporter SGLT 1 and 2, and other is GLUT. These GLUT are facilitated diffusion. These are facilitated diffusion. SGLT 1 is only in the small intestine and in the kidney, but 2 is only in the kidney, not in the intestine. So if someone asks you SGLT2, it is present in the intestine or kidney, answer is only in the kidney. But SGLT1 is in the kidney as well as in the intestine. But what about the GLUT? GLUT are example of facilitated diffusion. GLUT are example of facilitated diffusion like GLUT1. GLUT1 is in the brain, blood-brain barrier, placenta, RBC and colon. Okay. GLUT2, the mnemonic is beta cell like. GLUT2 is present in the beta cell, in the liver, intestine and the kidney. GLUT3 is present also in the brain, but GLUT4 is the only GLUT which is insulin dependent. Which GLUT is insulin dependent, doctor? It is GLUT4, and it is present in the skeletal muscle, in the cardiac muscle and in the adipose tissue. GLUT5 F for 5 and F for fructose. F for 5 and F for fructose. So GLUT5 is for what? It is for the fructose present in the sperm and in the jejunum. Remember, F for 5 and F is also for fructose. It is present where? In the jejunum for fructose absorption and in the sperm also. GLUT6 and GLUT7 are not that important. But remember GLUT2 in the beta cell, in the liver, intestine and in the kidney. This is very, very important. Okay. Now, which of the following has maximum smooth muscles as compared to the wall thickness? Which of the following has maximum smooth muscles? Respiratory bronchiole, alveoli, terminal bronchiole or alveolar duct? What is the answer? Anyone? You know there are two types of airways. One is conducting airway, other is respiratory airway. These are the topics which need to be remembered every time because this is the question. But the whole topic is what? There are two types of, yes, answer is terminal. Very good. Most of you are correct. So there are two types of airway. One is conducting airway and other is respiratory airway. There are two types of airway. One is conducting airway, other is respiratory airway. 16 are conducting airway and 7 are respiratory airway. Conducting airway start from trachea. It start from, thanks sir, thanks Raju sir, thanks a lot, trachea to the terminal bronchiole, T to T. So conducting airway are from T to T. T means trachea to terminal bronchiole and 7 are respiratory. They start from respiratory bronchiole up to the alveoli. Up to the alveoli. And these are the conducting airway. These are just anatomical dead space. They are having the air which is not participating gas exchange. So they are called as conducting airway. Okay, and this is your respiratory airway. This is for exchanging the gas. Now these are having maximum smooth muscle so that they can cause bronchoconstriction, bronchodilation. Okay, so this is about the airway. So these are respiratory airway and this is your conducting airway. So only conducting airway will have smooth muscle. Okay. Yes, I'll try to share all those questions. Raj Lakshmi, I will try to share this. So during a 100-meter sprint, which of the following is the muscle for meeting energy demand? So immediately the energy demand is favored by phosphorofructokinase, phosphocreatinine, glucose 1-phosphate or creatinine phosphokinase. What is the answer? What is the sequence, by the way? First of all, sequence is creatinine phosphate. Before that, directly they will get energy from ATP. Okay, then creatinine phosphate. Then they will get energy from anaerobic source like glycolysis. And after that, for example, someone is running the marathon, then answer will be aerobic. So first answer will be creatinine phosphate. Creatinine phosphate. Golgi tendon. This topic, almost 2 or 3 questions are confirmatory in any examination. Golgi tendon organ is innervated by which nerve fiber? 1A, 1B, 2 or 3. Golgi tendon organ is innervated by which nerve fiber? 1A, 1B, 2 or 3. What is the answer? Dr. FMGE B, okay. Okay, B, very good. See, this is, let me make a diagram for you. This is your extrafusal fiber. This is your spinal cord. This is your Golgi tendon organ. Golgi tendon organ are receiving from 1B, and muscle spindle are receiving from 1A and 2. And the efferent will be alpha motor and will be gamma motor. Now this diagram is very, very important. This is your, what is this, doctor? This is your muscle spindle. This is muscle spindle, and this is Golgi tendon organ. This is Golgi tendon organ. So muscle spindle efferent are 1A and 2, and the efferent are alpha and gamma motor. On the other hand, Golgi tendon organ efferent will be 1B, and efferent is to inhibit the alpha motor neuron. So answer is, of course, answer will be 1B, because 1A and 2 are from muscle spindle. They are from muscle spindle. You can see in this diagram also, this is your Golgi tendon organ. It is giving efferent by 1B. Efferent via 1B, and efferent is to inhibit the alpha motor. Okay. This is about Golgi tendon, and this is about the muscle spindle. Do you remember muscle spindle are of two types? One is nuclear back fiber. This will be nuclear back fiber, and this will be nuclear chain fiber. Yes, Mohan Singh, you want me to repeat this? Okay. See, this is your muscle. This is your extrafusal fiber, and this is your intrafusal fiber, which is called as a muscle spindle. So inside your muscle, you have intrafusal fiber, also called as muscle spindle. Muscle spindle are giving efferent via 1A and 2, and efferent via alpha and gamma. So efferent are alpha motor and gamma motor. The function of alpha motor is to cause muscle contraction, and the function of gamma motor is to increase the sensitivity of the spindle. Should I zoom this? Alpha motor is to cause muscle contraction, and gamma is to increase the sensitivity of the muscle spindle. So this is about your muscle spindle. And the second sensor is GTO. Second is about GTO, means Golgi tendon organ. This, the efferent is 1B, and the efferent is to inhibit the alpha motor. See, just see this diagram. There are two types of reflexes. One is stretch reflex, other is inverse stretch reflex. Stretch reflex sensor is muscle spindle, and in the inverse stretch reflex sensor is Golgi tendon organ. And what is the stimulus of stretch reflex, doctor? It is passive stretch. On the other hand, the stimulus is passive or active in case of inverse stretch reflex. Efferent of stretch reflex is 1A and 2. On the other hand, the efferent for inverse stretch is 1B. Effect of stretch is to cause muscle contraction. On the other hand, the effect of inverse stretch is to cause muscle relaxation. If you are taking some weight, and if you keep on increasing the weight, muscle will contract. But if you exceed the limit, muscle will relax. And that is called as inverse stretch. As soon as you keep on increasing the weight, muscle keep on contracting. That is called as stretch reflex. But as soon as you increase the load, a time will come when muscle will relax, and that is called as inverse stretch reflex. Okay, next question. Pain and temperature is carried by anterior spinothalamic tract, lateral spinothalamic tract, dorsal column, or ventral column. What is the answer? Pain and temperature, pain, temperature, and I can also add one more thing. Yes, very good. So pain and temperature is by lateral spinothalamic tract. Very good. What about anterior tract? What about anterior tract? Anyone can tell me? It is crude touch. Crude touch can be anything. It can be itch. It can be tickling. Okay. Okay. What about dorsal column pathway? Yes, lateral में तो okay. Lateral is to लात मारो तो पेन होगा. Very good. Pain and temperature. Very good. Very good. Good mnemonic. Anterior is for crude touch, and whatever is remaining, that will be the dorsal column. That will be the dorsal column. So dorsal column is fast, number one. Anterolateral is slow. Dorsal column is more myelinated. Anterolateral is less myelinated. Crude touch, pain and temperature is for anterolateral. Whatever is left, like 2-point discrimination, vibration, proprioception, all are through the dorsal column. Now, which will cross the medulla, dorsal or anterolateral? Which crosses the medulla? Which will cross the medulla? Dorsal will cross the medulla, while anterolateral will cross at the level of spinal cord. Okay. Now, one point is very, very important. What is Brown-Séquard syndrome? What is Brown-Séquard syndrome? Brown-Séquard syndrome is functional hemisection of spinal cord. So when there is functional hemisection of spinal cord, it is called as Brown-Séquard syndrome. So if there is hemisection, what will be the damage? Damage will be ipsilateral dorsal column, but contralateral anterolateral column. Means all the sensation from dorsal column will go from the same side. All sensation will be lost from the same side, but pain and temperature will be lost from the contralateral side. Pain and temperature will be lost from the contralateral side. Is this clear? Brown-Séquard syndrome. Okay. Now again the same question. SGLT is where? Intestine. Steroid synthesis occur in which organelle? Steroid synthesis is occurring in which organelle? Of course, smooth endoplasmic reticulum. It is smooth endoplasmic reticulum. Now, some image-based question. Let me start with this. Above diagram depict which mechanism? This diagram is depicting which mechanism? Counter current multiplier, counter current exchanger, acidification of the urine, or all of the above? Yes, this diagram depict, this is not above, this is below, of course. In this image, this will be coming below. The below diagram is depicting which mechanism? Counter current multiplier or exchanger. Very good, Mohan Singh, Sahib Pathan. Yes, this is counter current exchanger because this is vasa recta. Vasa recta here, if this would have been the straight, all osmolarity will be lost. But this is vasa recta. So vasa recta is responsible for counter current exchanger, not counter current multiplier. Very good. Excellent. Volume of bladder is not increasing with increase in pressure because of inherent property of plasticity, Laplace law, both 1 and 2, or elasticity. Why volume of bladder is not increasing with pressure? Just see the diagram. Let me enlarge it for you. If we zoom the diagram, we can say that even when pressure is increasing, volume is not increasing. Yes. Can you appreciate this diagram? Or simply try to understand volume of bladder is not increasing even with increase in pressure. Why? Smooth muscles are plastic. Very good. But answer is also B. Why? Laplace law say P is equal to 2T by R. Because if you increase the tension and also the radius, pressure will remain constant. So plasticity is the property of the smooth muscle. Tell me one thing, your stomach is plastic or elastic? Stomach is plastic or elastic? What do you think? Stomach is plastic or elastic? Stomach is not elastic. See, lungs are elastic. When we take air inside, it come outside. But stomach is elastic, not plastic, because it has to accommodate the food. If you are taking the food inside, it will not go out because it is not elastic. Similarly, urinary bladder, the uterus, all they are plastic because they have to accommodate something or the other. Uterus have to accommodate the baby, okay, and urinary bladder have to accommodate the urine. They are plastic. Remember that smooth muscles are plastic in nature due to Laplace law. Answer will be C. Both 1 and 2 are correct. Next question. X in the above diagram is. In the above diagram, what is the X? Is it RMP? Is it action potential, MMC, or peristalsis? What is X in the above diagram? Resting membrane potential, action potential, migratory motor complex, or peristalsis. What is this X? What is this? Is it RMP, action potential? These are repeat MCQ and they are very, very frequently asked. Yes, very good. Answer is not A, answer is B. Answer is B. B means, okay, let me make the diagram for you. See, these are your basic electric rhythm. And this is the threshold. This is your basic electric rhythm, also called as slow waves. These are also called as slow waves, and these are generated by cell of Kajal, also called as cell of Kahal. Okay, so these are your resting membrane potential, the slow waves. But only when there is a stretch, they will start rising like this, and when they touch the threshold, there will be spike potential, which will cause peristalsis, and these are called as spike potential, which is also the action potential. So in the above diagram, you will see that RMP, these are what? These are your basic electric rhythm. And these are your spike potential, or you can say action potential. And only when there is action potential, there will be mechanical contraction. So when slow waves are converted into action potential, they will cause, yes, Kajal cell. So they will cause migratory motor complex or peristalsis, any mechanical activity. Okay. Now A, B, C in the image is, just see the timings, 12 a.m., 4 a.m., 8 a.m. This is the first rising, this is the second rising, and this is the third rising. What is A, B, and C? First, what will rise? Then second will rise and third will rise. This is a common sense MCQ. And this is the only hormone which is obeying circadian rhythm. This is the only hormone that obeys circadian rhythm. If you see the peak is occupied first by this, then this, and then this. Yes, melodiphone A. Okay, good. C, B, C. Yes, answer is A. Very good. CRH from hypothalamus will stimulate ACTH. Then this will rise in the pituitary gland, and then this will stimulate adrenal cortex, so cortisol will rise. It will be like sequence CRH, ACTH, and then cortisol. Drug canagliflozin is used in diabetes, is the inhibitor of. Canagliflozin used in diabetes is inhibitor of SGLT1, SGLT2, GLUT2 or GLUT4. What is the correct answer, doctor? Just now we have discussed in the kidney, maximum glucose absorption is by SGLT1 or 2 that have to be inhibited. Yes, Saurabh Survanshi? B. Very good. Most of you are saying very good. B. SGLT2. All glyphlosins, Cana, Depa, Empa, these are SGLT2 blocker. These are SGLT2 blocker because 90% of glucose in the PCT is absorbed by SGLT2. So in diabetes, we give SGLT2 blocker. Good. Platelet adhesion and platelet aggregation is caused respectively by which glycoprotein? 1B9A, 2B3A, 2B3A, 1B9A, 4B2A, 2B3A. Adhesion and aggregation. Yes, Ehtisham Zafar, you are correct. It can cause UTI. That is why it should be given empty stomach with lot of water, and mainly to the male patient, because UTI will be common more in females if you are using glyphlosins. Platelet adhesion and platelet aggregation is caused respectively by 1B9A. Very good. Most of you are correct. Adhesion is by 1B9A. 1B9A is responsible for adhesion. And if there is a mutation of this glycoprotein, it causes Bernard-Shawlier disease. If there is problem of adhesion, it causes Bernard-Shawlier disease. And aggregation defect is by 2B3A, and that is called as Glangeman thrombocythemia. Glangeman thrombocythemia, or simply thrombocythemia. Sometimes they don't give Glangeman. They say what defect happened in thrombocythemia. Then you will say platelet aggregation. Platelet aggregation is by glycoprotein 2B3A and adhesion is by 1B9A. Okay. Above ECG shows which abnormality? T wave is tented and PR interval is prolonged. So T wave is tented in which electrolyte abnormality? Hypocalcemia, hypercalcemia, hypokalemia, or hyperkalemia? Yes. Very good. Hyperkalemia. Very good. Excellent. T wave is tented, tall tented T wave you will get in hyperkalemia, and in hypokalemia you will get inverted T wave. You will get inverted T wave. Good. Next question. Plateau phase in the cardiac action potential is mainly due to. This plateau phase in the cardiac action potential is mainly due to sodium channel, T calcium, L calcium, none. Plateau phase in the cardiac action potential. This is the plateau phase. Phase 2. It is due to sodium channel, T type of calcium channel, L type of calcium, or none of the above. Yes, calcium, you are absolutely correct, but T or L, very good, excellent. L type. See, T type calcium is only seen in pacemaker potential. Pacemaker potential, the funny leaky channels for this responsibility is taken by T calcium. Rest everywhere you get L calcium. Long lasting. Long lasting. So answer is C. Very good. Type 1 glomus cells have. Type 1 glomus cells are present in the carotid body and aortic body. They have which channel? Oxygen sensitive potassium channel, oxygen sensitive sodium channel, proton sensitive potassium, or carbon dioxide sensitive. You know, these are chemoreceptor. These are chemoreceptor, peripheral chemoreceptor. They are peripheral chemoreceptor, and they are sensitive to hypoxia. They are sensitive to hypoxia, hypercapnia, and acidosis. Yes, they are sensitive to hypoxia mainly. So answer is oxygen sensitive potassium, not carbon dioxide sensitive. Oxygen sensitive potassium channel. Okay, this is a repeat MCQ for FMG examination. Please don't forget, glomus cells are the part of chemoreceptor in the carotid body and aortic body, and they are sensitive to hypoxia, hypercapnia, and acidosis, and they have oxygen sensitive potassium channel. Okay, the test, this test is to check integrity of what? This test is to check integrity of which part of the brain? Suppose if you are doing like that and you cannot do and you are doing like this, finger nose test. This test is to check integrity of cerebral cortex, cerebellum, basal ganglion, or Papage circuit. This test is done to check integrity of finger nose test. Yes, very good. It is cerebellum. Dysmetria. Okay, very good. Finger nose test, finger test. You know that. This is all done for cerebellum. Good. Now, which follicle of the thyroid is active? A or B? This is A or this is B? Which follicle of the thyroid from the recent FMG examination? They have given two images and they ask which is active? A or B? Which is active? A or B? Yes, very good. Answer is B. Why B? Because see, thyroglobulin is abundant in the A. Thyroglobulin is abundant in the A. So it means it is a passive. If there is a lot of thyroglobulin, it means it is passive. On the other hand, very less thyroglobulin in the B. So lesser is the thyroglobulin, more will be the activity. More will be the activity. These types of questions are asked nowadays. They will give you follicle and they will give you thyroglobulin. Let me clear this page and you will see again. Okay, so this has lot of thyroglobulin. It means this follicle is passive, and this has lesser thyroglobulin. What does this mean? It means it is very active. It is forming lot of thyroid hormone. It is forming lot of thyroid hormone. That is why this is active. Okay. K complex and sleep spindle are characteristic of REM sleep, NREM1, NREM2, or NREM3. K complex, you can see here. K complex. K complex are like this, and sleep spindles are like this. These are characteristic of which type of sleep? REM sleep, NREM stage 1, or NREM stage 2, or NREM stage 3. Very good. Anarium stage 2 sleep. Answer will be C. Stage 2 is very, very characteristic of stage 2 is very, very characteristic of K complex. So answer is C. Above image is showing which property of the lung. This is inflammation curve. This is deflation curve. And both are different. If lung is inflating, it is behaving differently. If lung is deflating, it is behaving differently. And what is this called as? Hysteresis, inflation curve, deflation curve, or Herring-Brew reflex. Which property of the lung is shown by this diagram? CAAC, okay. Which property is shown by this? Very good. Answer is A, hysteresis. But in one examination, not in FMG, it was asked in NEET PG. In FMG, this can also be asked. What is the cause of hysteresis? Till now, it was not asking hysteresis. This in FMG, but this can be asked because it is repeat from NEET PG. Cause is the difference in the concentration of surfactant during inspiration and expiration. Okay, so why we are getting hysteresis? Because there is difference in the concentration of surfactant during inspiration and during expiration. This is the real cause of hysteresis in the lung. Sulfonylurea act on which channel? Voltage gated calcium channel, ATP dependent potassium channel, GLUT2 or all of the above. Sulfonylurea drug like glimepiride, gliclazide, glimepiride, glibenclamide, all these sulfonylurea act on which channel? Yes, answer is D, A. D means all of the above. A means voltage rated calcium. If you remember in the beta cell, which channel is present? Or this question can be asked in some other manner. That beta cell of the pancreas has which channel on which sulfonylurea drug act? Answer is ATP sensitive or dependent potassium channel. ATP dependent potassium channel. Answer is only B, not all. Okay, that is why normally when we take glucose, insulin will come out. But when you take sulfonylurea drug, even without food, insulin is coming. So these drugs can cause hypoglycemia. These drugs can cause weight gain. These two are very commonly asked question. The most common side effect of sulfonylurea is weight gain and hypoglycemia because they are working on ATP dependent potassium channel. Okay, is this clear? Above connections are, which circuit is this? Just see that. I will zoom for you. Just see cingulate gyrus, hippocampus, mammillary body, and anterior nucleus of the thalamus. Which circuit is this? Very famous circuit, you know that. Limbic cortex, Pepper circuit, hypothalamus or the thalamus. Cingulate gyrus, hippocampus, mammillary body, and anterior nucleus of the thalamus. Yes, mnemonic is CHMT. Hippocampus, mammillary body, and the thalamus. HMT. Yes, very good. Answer is Pepage circuit. Pepage circuit. Okay. Coming back to this question. Fiber mainly affected by local anesthesia. Which fiber is mainly affected by local anesthesia? A beta, A delta, B fiber, C fiber. Although this is a controversial question because in Genome something else is given, but we follow clinical books like anesthesia. Okay, let me tell you, there are three questions which it is sensitive to pressure. For pressure, number 2 hypoxia, and number 3 is local anesthesia. For pressure, A is most sensitive, then B, and then C. Okay, for hypoxia, B more sensitive than A, then C. For local anesthesia, A gamma and A delta greater than A alpha and A beta greater than B greater than C. A gamma and A delta are most sensitive according to the recent literature. Okay, so please don't say it is CBA. Answer is A delta. In these option, answer will be either it can be A gamma or A delta, whatever, but A delta is given, so answer will be A delta. These are often repeated MCQ. For pressure, A is most sensitive, then B, then C. For hypoxia, BAC, BAC. And for local anesthesia, it is A gamma, A delta, then A alpha, A beta, and then B, and then C. Am I clear? Which is true about the Rio base? Minimum time required to produce action potential. I must be away from this. Let me. Okay, now you can read. Minimum time required to produce action potential, maximum time required to produce action potential, minimum strength. Yes, Abhishek Verma, this video will be saved on the YouTube. You can see after this live session, you can see again, no problem. Minimum strength of the stimulus to produce action potential or maximum strength of stimulus. What is the answer? A, B, C or D? Yes, D, C. Yeah, Shadma, PDF we will share, no problem. On DocTutorial Telegram group, we will share this. Okay, so most of you are correct. Minimum strength of stimulus to produce action potential. See this diagram. If we put the diagram, the minimum voltage to produce action potential is called as Rio base. Point number 1. What is the Rio base? If you plot the diagram between voltage and the time, the minimum strength of the current that can produce action potential is called as Rio base. Thanks, Astos. And the time taken by Rio base, what is this time called as? Time taken by this Rio base is called as utilization time. Time taken by Rio base is called as utilization time. So the minimum strength that can produce action potential is called as Rio base, and time taken by Rio base is called as utilization time. But even important than this is called as chronaxy. Chronaxy is even important than that. What is chronaxy? Time taken by double of Rio base. If you double the Rio base, time will be less or more. If you double the Rio base, time will be less or more. Tell me, time will be less, and that is called as chronaxy. That is called as chronaxy. See, this is the curve between strength and the time. This is called as, this much is called as Rio base. This is called as utilization time. And if you double the current, time will be less, and this time is called as chronaxy. This is called as chronaxy. So lesser is the chronaxy, more is the excitability. More is the excitability. Okay. Now, which of these can send potassium inside the cell? If there is hyperkalemia, which hormone is given to put potassium inside the cell? Insulin, glucagon, TSH or FSH? It is given in hyperkalemia. In hyperkalemia, first we give calcium. Why? To stabilize the membrane. Then we give a hormone. It's very good. Insulin. Insulin put potassium inside the cell. That is why in hyperkalemia we use insulin. Okay, good. Everyone is correct. Placenta to fetus glucose is transported by. Just now we have discussed placenta to fetus glucose. In the placenta we have glut. Remember glut 1. Glut 1 is the example of what? Endocytosis, active transport, facilitated diffusion, simple diffusion. Thanks, Doctor. Step towards Doc. You are most welcome always. So, placenta to fetus glucose is transported via glut. You know that glut? Okay, there is SGLT. SGLT is for kidney and intestine, and this is secondary active transporter, doctor. But what is glut? Very good, excellent. Excellent, all are correct. Very good. Facilitated. See, one question is for sure. Either it can be in the glut or SGLT. A question तो आना ही आना है. Okay, so glut is example of facilitated diffusion. Very good, doctor. Now, during except excitatory synaptic transmission, all are true except excitatory synaptic potential, EPSP, release acetylcholine, calcium influx increase, decrease potassium influx, or increase chloride influx. This question is regarding excitatory post-synaptic potential. Yes, yes, very good, excellent, Raj Lakshmi. You are correct. See, there are two types of potential. One is excitatory post-synaptic potential. Other is inhibitory post-synaptic potential. This causes depolarization. This causes hyperpolarization. This is due to influx of cation. This is due to influx of cation, and this is due to influx of anion, like chloride, mainly chloride. It can be because of sodium, potassium. These all are cation. So if there is influx of cation, it is excitatory post-synaptic potential. If there is influx of anion, like chloride, it will be inhibitory post-synaptic potential. Very easy. Which of the following is true regarding paracrine communication? Paracrine communication. Action across synaptic cleft, directly from cell to cell, by diffusion in the interstitial fluid, or by circulating body fluids. Which of the following is true about paracrine stimulation? There is autocrine, paracrine, and endocrine. There are three terms. So paracrine is BC. Yes, answer is B. Cell to cell. See this diagram. If cell is stimulating its own, it is autocrine. If one cell is stimulating the other, it is paracrine. And if something goes in the blood circulation and activating the target cell, it is endocrine. So cell to itself, it is autocrine. One cell to other cell is a paracrine. And something is going in the blood circulation and activating the distant organ, it is your endocrine. It is endocrine. Am I clear? The answer is cell to cell. Now, this question is regarding sodium potassium pump. Which option is correct regarding sodium potassium pump? Which option is correct for sodium potassium? It is very easy option, by the way. The electrogenic sodium potassium ATPase pump using energy in ATP to extrude 3 sodium out and 2 potassium in. Or what is the correct answer? Yeah, most of you are correct. It is taking 3 sodium out and 2 potassium in. Yes. So coupling ratio is 3:2. Very good. Coupling ratio is 3:2 and 1 ATP is used for this. Now this sodium potassium pump is homodimer or heterodimer? It is homodimer. Yes, Sunava, Chitraji. Yes, this video will be available later on also. Okay, let me tell you. This pump is the most common pump and this is heterodimer. One of the FMG examination they ask sodium potassium pump is homodimer or heterodimer. Answer is it is heterodimer because it has 2 subunit alpha and beta. It has 2 subunit alpha and beta. Now, which is the most important function? Cell volume regulation or RMP maintenance? What is the most important function for sodium potassium pump? Is it cell volume regulation or RMP? Most doctor answer RMP. No, answer is cell volume regulation is the most important function of this. RMP maintenance is the second important, but cell volume regulation is more important in comparison to the RMP. Good. All of the following are calcium binding protein in the muscle except troponin, calmodulin, dystrophin, all calcineurin. All are calcium binding protein except troponin, calmodulin, dystrophin or calcineurin. What is the correct answer, doctor? A. See, troponin C bind with calcium to cause contraction of the skeletal muscle. You know this. You know this. Troponin C bind with calcium to cause contraction of the skeletal muscle. Calmodulin also bind with calcium to cause contraction of the smooth muscle. Yes. Dystrophin is the protein which transfer contraction of muscle into the bone. Calcineurin also bind with calcium. So dystrophin is the protein which is not calcium binding, and the mutation of dystrophin can cause Duchenne muscular dystrophy. Duchenne muscular dystrophy is caused by mutation of dystrophin. And which sign is very famous sign? Gower sign. I hope you remember Gower sign, which is the most characteristic sign for Duchenne muscular dystrophy. It is the Gower sign. If you say the patient to stand up, okay, he will climb on his own limb. This is called as Gower sign. And the protein is dystrophin. The protein is dystrophin. Okay, so Duchenne muscular dystrophy. Which of the following is correct statement? Just look into the option, then I will explain. Desmosome help to attach cell to the basal lamina. Hemidesmosome helps to attach cell to each other. Tight junction permit passage of some solute, or gap junction prevent the movement of protein in the plane of cell membrane. Which is correct option? Which is the correct option? A, B, C. See, these all are repeat MCQ. That is why I am telling you now, they are repeating the same topic again and again. So you must be thorough with at least the topics. Okay, let me tell you. Desmosome help to test cell to cell, not cell to basement membrane. This is wrong. Desmosome help to attach cell to cell. Hemidesmosome cause attachment of cell to basement membrane, not cell to cell. Okay. Tight junction permit passage of some solute between the cell. Yes, this is correct. Now, a lot of you think that tight junction does not allow passage of ion. No, tight junction can be very tight or leaky also, because PCT is having tight junction, but they are allowing passage of solutes. So this is the only option which is correct. And gap junction does not prevent; they cause the movement of protein in the cell membrane. So the only option which is correct is tight junction permit. And this is a repeat MCQ. 2 or 3 times this MCQ has been asked in your FMG examination. So remember, just see this diagram. Desmosome, this is hemidesmosome. Hemidesmosome is attaching cell with the basement membrane. Desmosome is attaching cell with the cell. This is the tight junction and this is the gap junction. Okay, so cell to cell desmosome, cell to basement membrane, it is hemidesmosome, and gap junctions allow, as well as tight junction also allow passage of some ion, not all ion. Am I clear? All are true about fluid and electrolyte except intracellular fluid constitute 40% of body weight. Interstitial fluid constitute 15% of body weight. Insensible loss are 400 to 800. Chloride inside cell is more than outside. Which is the all are true. So all are true except one. Which is the wrong option? Which option is not correct? Dr. D, yes, B. Ehtisham Zafar, D, okay. Raj Lakshmi, D. Images are blurry. Yes, answer is D. Answer is D. Intracellular fluid. See, 60% of your body is water. Out of this 60%, 40% is inside the cell, intracellular. 20% is outside the cell. Out of this 20%, 15% is interstitial and 5% is the plasma. And insensible loss of the fluid is 700 ml. 700 ml. And chloride is inside? No. Sodium and chloride is more in the ECF. So this option is wrong option. This option is wrong. So answer will be D. Answer will be D. Am I clear? Okay. Motor neuron of spinal cord is unipolar, bipolar, pseudo-unipolar or multipolar. Motor neuron of spinal cord is the example of unipole, bipolar cell, pseudo-unipolar cell or multipolar cell. What is the correct answer? Yes, M is for M. M for motor is for multipolar. B, bipolar. No, it is not bipolar. It is multipolar. Now let me just show you this. See, this is your unipolar. Example of unipolar is mesencephalic nucleus. Unipolar does not have separate dendrite and axon. Okay. Pseudo unipolar is actually bipolar. It look like unipolar. And the example of pseudo unipolar is dorsal root ganglion. So example of bipolar is dorsal root ganglion. Bipolar का example है retina, olfactory epithelium. And multipolar example is Purkinje cell, motor neuron and hippocampal pyramidal cell. Please do remember this example. These are very, very, very important. Okay. So next question. This has been done already. Which of the following is responsible for skeletal muscle relaxation? Which of the following is responsible for skeletal muscle relaxation? Dystrophin, tropomyosin, myosin or actin? Which of the following is responsible for relaxation? C. What is C? C is myosin. A is dystrophin. Which is relaxing protein? Which is the relaxing protein? Who will tell me? No one is telling correct answer. Why? Myosin is a relaxing protein. This topic is very, very important. Very, very important. Prafull Garg is the only who has given the correct answer. Vijaya Kumari also. Tropomyosin. Do you remember the orientation of this? Okay, let me make the diagram for this. This is your, what is this? This is your actin. This is your actin. These are your G actin or F actin? F actin. And this is your tropomyosin. This is your tropomyosin. And these are troponin. These are troponin. Tropomyosin cover what? Tropomyosin, it cover myosin binding site on actin so that muscle cannot contract. See, tropomyosin wrap around the actin like a DNA, helical structure, and it cover myosin binding site on the actin. That is why tropomyosin is helping in relaxation. It is inhibiting the contraction. It does not allow contraction, it inhibits contraction. Actin myosin are contractile protein, and these are troponin. Troponin are of three types. Troponin are of three types. Three subunit of troponin are there: troponin T, troponin I, and troponin C. Troponin T binds with tropomyosin. Troponin I inhibit actin myosin binding, and troponin C is for calcium. So when calcium comes, there is a conformational change which will uncover myosin binding site. And then actin myosin will cause contraction. Are you getting my point? So tropomyosin is inhibiting the contraction, but when calcium comes, troponin C will bind with troponin, calcium, and this will uncover myosin binding site on the actin and contraction will happen. So remember, tropomyosin is responsible for relaxation. These are causing contraction. Dystrophin is causing transfer of contraction to the bone. And I have told you, mutation of dystrophin causes Duchenne muscular dystrophy. Causes Duchenne muscular dystrophy. Now next question fast. Which of the following is a unique feature of smooth muscles? Just now we have discussed that. Tetany, plasticity, or excitation contraction coupling. Tetany, plasticity. Just now we have discussed this point. Smooth muscle like stomach, urinary bladder, uterus. These are elastic or these are plastic. Physiology is all about concept. In one day you cannot build up concept, but of course we can do the revision. And believe me, after this whole class, I will cover 90% of the topic which can be asked. But you have to be very, very concentrated. Yes, very good. Plasticity. For your exam purpose, never forget this is a unique property of the smooth muscle due to Laplace law, which I have discussed earlier. All are secondary messenger except cyclic AMP, IP3, DAG, or guanyl cyclase. All are secondary messenger except cyclic AMP, diacylglycerol, or IP3 guanyl cyclase. Very good, Prafulgar. Cyclic AMP is the secondary messenger for GS and GI. G stimulatory and G inhibitory. In GS, cyclic AMP is increased. In GI, cyclic AMP is decreased. IP3 DAG along with calcium is the secondary messenger for GQ. And guanylate cyclase, this is not secondary messenger, this is a enzyme. I hope you remember GS. अभिमन्यु, ये आवाज कैसी? ये मोर की आवाज है. This is peacock. Okay, so cyclic AMP is GS and GI, IP3 DAG and calcium is GQ, and guanyl cyclase is a enzyme. Okay, so you must remember almost all are example of GS. These are the hormone that are example for GS. No, don't forget, two questions are for sure in physiology and medicine: epinephrine, norepinephrine, glucagon. Okay, TSH, FSH, MSH, ACTH, creatine, calcitonin, these all are example of GS. And GI, somatostatin, angiotensin 2, alpha 2, muscarinic 2 and muscarinic 4, these are GI. And all releasing hormone are example of GQ. All releasing hormone are example of GQ except corticotropin releasing hormone, which is example of GS. See, whenever they ask you about releasing hormone, answer is always GQ. Like TRH, whatever the releasing hormone, only corticotropin releasing hormone is example of GS. Okay, this PDF I will share in the DocTutorial Telegram group. Permeability of which ion cause resting membrane potential? Permeability of which ion, we have discussed this point. Whenever they ask you RMP, which ion should come in your mind? कभी भी ये RMP की बात करेंगे, which ion is the most important for generation of resting membrane potential? Yes, potassium always. Good. Decrease extracellular calcium lead to. If there is hypocalcemia, if there is hypocalcemia, it will decrease excitability or decrease stability. It means increase excitability. What is the answer? Hypocalcemia. Of course, it will cause tetany. C is increased amount of depression needed. Yes, Saurabh Survansi. Answer is आप पीकॉक को पाल रहे हो, नहीं पीकॉक हमको पाल रहा है. No, it is by chance. Otherwise, okay, answer is, let me tell you, answer is B. See, calcium stabilizes the membrane. Please remember, calcium stabilizes the membrane. So you can say it decreases excitability. Calcium decreases the what? Decreases the excitability by increasing the stabilization. Calcium stabilizes the membrane. So if calcium is low, stability will be low, excitability will be high. That is why there are two signs of tetany. One is called as Chostek sign. Other is called as Strauss's sign. There are two signs. If you trap the facial nerve, there is contraction of the facial muscle. This is called as Chostek sign. And Strauss's sign, if you generate ischemia, okay, there will be carpopedal spasm. These two you will see in the surgery. Very oftenly asked question in the surgery. Chostek sign and the Strauss's sign are characteristic of hypocalcemia or the tetany. So who will tell me what are the three conditions which can cause tetany? What are the three conditions which can cause tetany? Yes, please. Number one, you know, hypocalcemia. Number two, hypomagnesemia and metabolic alkalosis. All has been asked in your examination. What are the three conditions that causes tetany? They are hypocalcemia, hypomagnesemia and metabolic alkalosis. and metabolic alkalosis. Okay. So tetany is neuromuscular excitability. It can be because of these three conditions. Excuse me. Hypocalcemia, hypomagnesemia, and alkalosis. Chostek sign is contracture of the facial muscle upon tapping the facial nerve. And Trausi sign is carpopedal spasm after ischemia. Okay? Which of the following is neurotransmitter at preganglionic area? Any preganglionic area, who is the neurotransmitter? Yes, Abhimanyu, we will get carpopedal spasm like this. Because of excessive muscle contraction, it is called as carpopedal spasm, especially if there is ischemia. If there is ischemia. Okay? Is this clear? Yes, very good. Acetylcholine. Very good. Acetylcholine is the neurotransmitter. Okay, what are the questions that are asked regarding acetylcholine? What are the questions that are asked regarding acetylcholine? Number one, neuromuscular junction causes muscle contraction. Number two, basal forebrain. If it degenerates, it causes Alzheimer. Number three, it promotes REM sleep in learning and memory. Number four, cholinergic sympathetic is the sweat gland. Cholinergic sympathetic is the sweat gland. These are the four questions that can be asked regarding acetylcholine. Resting membrane potential of rods. This is a typical FMG question. Typical FMG question. How much is the RMP? Please do fast. Time is very less. Minus 40C. That is why I have given you table. Please, you can take a screenshot of this and remember that rods have minus 40, RBC has minus 12. This is a typical question which I have seen only in FMG. They keep on asking about rod and RBC. Rod has minus 40, RBC has minus 12. Rest you remember always. SA node minus 50, AV node minus 60, myocardium minus 90. So smooth muscle minus 55, skeleton minus 90, neuron minus 70. So this I cannot help you. You have to remember this. Nerve fiber first affected in case of hypoxia. Just now I have discussed back. B greater than A greater than C. Answer is B. So for pressure, A greater than B greater than C. For hypoxia, B greater than A greater than C. For local anesthesia, A gamma, A delta, A alpha, A beta, B and C. So this is a typical. You have to remember this. Okay. Fastest conducting nerve fiber is. Now you know that A fiber, B fiber and C fiber. A has A alpha, beta, gamma, delta. So A alpha is for proprioception. So that will be having maximum myelination. So maximum myelination means maximum conduction. Maximum A and B are myelinated, C is unmyelinated. This is called as Ehringer-Gasser classification. A alpha is for proprioception. A beta is for touch and pressure. A gamma is for motor to muscle spindle. A delta for pain and temperature. B is preganglionic. C is pain and also postganglionic. Please remember this is very, very, very important for your exam. Ehringer-Gasser classification and type of neuron. A alpha, maximum important, proprioception. Okay. Now again question, which of the following fiber is preganglionic? Just now I have discussed myelinated B fiber. It is myelinated B fiber. True about neuropraxia. There is three things. Neuropraxia, then axontemesis and then neurontemesis. What is true about neuropraxia? See the question and tell me the answer. Neuronal degeneration disruption of conduction, disrupted axon, structural change of the nerve. Faizan Bashir Mir, very good. B. Praful Gar, very good. Some of you are constantly answering correct answer. I am very, very glad. At least you must know the question which are repeated in the exam. Whatever question I am using today, these all are repeated topics. So you must remember for clearing your examination. C. What is neuropraxia? Neuropraxia is the physiological block. It is physiological discontinuation. Axon is intact with local myelin sheath damage only. Recovery is fast. Example is Saturday night palsy. Abhimanyu Patel, Saturday night palsy can be neuropraxia because it is because of pressure. It is physiological disruption. Okay. So this is only physiological conduction block. Answer is physiological conduction block only. Am I clear with this? Okay. Axontemesis. It is the nerve crush injury. Axon and myelin sheath both are damaged. In neuropraxia, only myelin was damaged. In axontemesis, axon is also damaged. In this, rest all things are intact. Valerian degeneration happen in what? Axontemesis. Valerian degeneration does not happen in neuropraxia. It happen in axontemesis. It's also a FMG question. It is an anterograde degeneration. Third, recovery will take at least week to month. It is worse than neuropraxia. And the worst type of injury is neurontemesis. Complete nerve injury. Endoneurium, perineurium, all are damaged. It is the most severe injury. And recovery is always incomplete. So only neurontemesis recovery is incomplete. Rest all can recover. Dr. D. Neurontemesis recovery is incomplete. Rest all can recover. It will take time, but they will recover. So in this question, neuropraxia, only disruption of conduction happen. It is a physiological disruption. It is the only physiological. Next question. Exchange between lung capillary and alveoli. You know, simple diffusion. Simple diffusion. Nothing to discuss. Just for your revision. Which nerve carry the pain? You know, A delta and C carry the pain. A delta carry first pain or fast pain. A delta carry first pain or fast pain. C carry slow pain or second pain. So answer is D fiber. Pain is carried by A delta and C. Tickling and itching is carried by which pathway? Just now we have discussed these are crude touch. These are simply nothing, they are simply crude touch. So you know anterior spinothalamic tract, tickling, itching, all these are crude touch. And crude touch are going through anterior spinothalamic tract. Isn't it? Okay. All of the following bands are covered by actin filament except which band is not covered by actin? This is myosin. Tell me, which band should I use other page? Okay. Which band is not covered by actin filament? Between actin and actin, the area between actin and actin is called as H band. So you can easily say this is actin, and the area between actin is called as H band. So easily you can say H band is not covered by actin. Answer is H band. Okay. Next question. You can see this is A band. This is A band. A band is formed by myosin mainly. I band is formed by actin, and H band is the area which is not covered by actin. Is the area which is not covered by actin. This area is H band. H band is the area which is not covered by actin, and it will decrease as contraction happen. Which band decreases? H band. This is the band. Okay. Thiazide diuretic act mainly on. Thiazide diuretic act mainly on PCT, TCT, loop of Henle, all part of the tubule. Yes, very good. It is DCT mainly. See this diagram. This is the distal convoluted tubule. This sodium chloride channel is blocked by thiazide. Okay. And if there is a mutation of this channel, what is that syndrome called as? Mutation of this channel syndrome is called as Gitelman. This is called as Gitelman syndrome. Am I clear? Mutation of this channel is called as Gitelman syndrome. So sodium chloride pump is blocked by thiazides, and mutation causes Gitelman syndrome. And this is one cell of distal cannulated tubule. This has sodium potassium pump. This has sodium calcium exchanger. And this also transport magnesium and calcium. This is a typical cell of distal cannulated tubule. Clear? Maximum vitamin C concentration is seen in. Repeat FMGE MCQ. I know these are very typical question, but very, very important question. Maximum vitamin C concentration is seen in adrenal gland. Why? Because catecholamine, all these things are synthesized in adrenal cortex and medulla, and they need ascorbic acid as a cofactor. Adrenal gland is among the organ which has highest concentration of vitamin C in the body. Why? Because cortex as well as medulla, they use ascorbic acid as a cofactor for synthesis of catecholamine as well as steroid. So remember, adrenal cortex as well as medulla. So properly you can say adrenal gland has maximum concentration of vitamin C because it had as a cofactor for synthesis of catecholamine as well as steroid hormone. Okay, these are typical previous year FMG paper, so you must remember. There is no option. You can mark new question wrong, it's okay, but you should never mark repeat MCQ wrong. Normal GFR 125 ml per minute, one liner. Which cell in the kidney are involved in the acid secretion? Pituitary gland, yes, of course, but maximum they are asked, and maximum vitamin C is in the adrenal cortex. Which cell in the kidney are involved in acid secretion? Very good, doctor. Principal cell is for action of ADH and action of aldosterone. Lasses cell are component of JG apparatus. Granular cells are other name for JG cell, which release renin. And intercalated cells are of two types, A cell and B cell. A cell secrete acid, B cell secrete base. All these cells are important for your exam. Lasses cell are extraglomerular mesangial cell, component of JG apparatus. Principal cell have action for ADH and aldosterone. Granular cell is the other name for JG cell, which synthesize renin. Intercalated cells are for acid and base secretion. Okay, so principal cell is for aldosterone and ADH. Intercalated cells is for acid secretion and base secretion. Collecting duct have these types of cells. Juxtaglomerular apparatus, JG apparatus. What is the location of JG apparatus? Question number 1. This topic is very important. Location. Juxta means near. It is near the glomerulus. Juxta apparatus is near to the glomerulus. Cell number 1 called as JG cell or granular cells, and they can sense hypoperfusion because they have beta 1 receptor. Which receptor is present on JG cell? Answer is beta 1 receptor. And what they release? They release renin hormone. So number 1 component of JG apparatus is, yes, JG cell called as granular cell. Second apparatus is macula densa. It is present in the thick ascending loop of Henle. And what it sense? It sense sodium, it sense chloride, or it sense both. It sense sodium as well as chloride. This is called as tubuloglomerular feedback mechanism. It is called as TGF, not KGF. Remember, it is not KGF, it is TGF, okay? Tubuloglomerular feedback mechanism. And the third cell of JG apparatus is Lassis cell, also called as Gur-Mac-Thai cell, also called as Paul-Kissens cell, and they are located between efferent and efferent. Function is not known. So these 3 are cells for JG apparatus. Macula densa is responsible for, I told you, KGF, no, TGF, tubuloglomerular feedback mechanism. Macula densa is responsible for TGF, tubuloglomerular feedback mechanism. All of the following increase vasopressin secretion except. All of the following increase ADH secretion: vomiting, ECF volume shrinkage, alcohol or tumor. Shlok, is this session enough for last minute? Say, I try to collect all type of question. This is my, but please revise your notes also, because physiology is about concept. Lot of effort is needed. You cannot mug up. But I tried to at least fill all the concept and all the fact which you need to remember in last minute. Okay, Shlok? At least revise this MCQ. I will share in the Telegram group of DocTutorial. Okay, so what can increase ADH? Except. Alcohol, yes. Alcohol is decreasing ADH. That is why if someone takes some alcohol, he has polyuria. After having alcohol, you feel like going to washroom because ADH become less. So you cannot absorb more water. See, just see the concept. Function of ADH is to take water. If you are losing the water every time you want to absorb more water, ADH will be high. But in alcohol, you are taking so much of, if you are taking some alcohol beverages like that, at that time, why you have polyuria? Because ADH is decreased by alcohol. So answer is alcohol. ADH is decreased by alcohol. Please do remember. Which is the principal buffer in the plasma? Which of the following is principal buffer in the plasma or is F? What is the answer, doctor? Which of the following is the principal buffer in the plasma? Yes, very good. Carbonic acid or bicarbonate is the most important buffer in the ECF. Hemoglobin or protein which contain histidine is the most abundant buffer in the body, not the plasma only. And this is in your urine. Okay, this is in the urine. So most important buffer in your body is bicarbonate, or we can say carbonic acid. Which cell in the kidney produce calcitriol? That is 125 dihydroxycholecalciferol is also called as calcitriol. Which cell in the kidney? Yes, Akshay Jain, bicarbonate ion can be written as in the form of acid as carbonic acid. Both are buffer. So vitamin D3, calcitriol, or 125 dihydroxycholecalciferol, they are important hormone released from PC. Is formed in the PCT because PCT have 1-alpha hydroxylase. In the presence of parathormone, vitamin D3 is formed. Percentage of GFR to renal plasma flow. It is called as filtration fraction. How much is the filtration fraction, doctor? GFR upon renal plasma flow. How much percentage of renal plasma flow is GFR? Yes, 20%. 20% of renal plasma flow, 20% is filtered as GFR. Please do remember, it is always 20%. Good. Which of the following combination is true about the hormone and its site of action? Tell me. Please do revise. These are factual question and you have to remember. Physiology is a very, very huge subject, but this is minimum which you have to remember. Yes, what is the answer? Yes, Khan, Danish Khan, very good. Aldosterone in the collecting duct, just now we have discussed. ANP in the loop of Henle, no. It is in the efferent arteriole. ADH in the collecting duct also. Angiotensin 2 in the distal, no. The only option that is correct is A. Mohan Singh, you are correct. Atisham, Naveen D. No, ADH in the collecting duct. Okay. Aldosterone act on collecting duct, same question. Carbon dioxide is mainly transported in the form of what? Bicarbonate form. Maximum transport is in the form of bicarbonate. Carbon dioxide, let me make this diagram for you. This is your RBC. Carbon dioxide will combine with, it form H2CO3, which break down into bicarbonate and H plus. Now this bicarbonate will go in exchange of chloride. Okay. Yes, Divyansh Gaur, you are not giving. For what? Which question? Okay. So this H plus will be buffered by deoxyhemoglobin. Okay. So maximum transport of carbon dioxide is by bicarbonate. Next question. Tubuloglobular feedback, TGF, is mediated by sensing what? Just now we discussed. Only sodium or sodium chloride, both? What is the answer? TGF is mediated by sensing of sodium in the macrodensa, sugar, water, or sodium chloride. What is the answer? I have told you it is both sodium as well as chloride. Yes, Divyansh, Ajam sir, video will be available. It will be soon. They are trying to upload it very, very soon. So I hope you will get very Maybe today or tomorrow. D, yes, very good. Sensing of sodium chloride both. Very good. In proximal tubule, H plus is exchanged for bicarbonate, potassium, chloride or sodium. Proton is exchanged for what? Proton is going in exchange of what? What is coming in exchange of proton? Very, very important question. You know, protons are secreted in the PCT. Protons are, of course, secreted in the PCT in exchange of what? Bicarbonate? No. See, one thing make it very clear. If one cation is going, other cation will come. If one anion is going, other anion will come. It is exchanging for sodium. This is the most common method of sodium absorption and proton secretion. Yes, Akshay Jain, you are correct. Answer is sodium. Very good. Osmotic diuretic act upon, like mannitol. Osmotic diuretic acting on which? Thiazide. You know, thiazide act where? Thiazide act on DCT. Okay. Loop diuretic, you know, furosemide and all. Furosemide act on loop of Henle. And what about osmotic diuretic? Osmotic diuretic act on PCT, DCT, ascending limb of loop of Henle or collecting duct. Yes, very good. Answer is PCT mainly. Okay. Diuretics are very important topic. Bicarbonate is absorbed through. Almost everything is maximally absorbed where? Almost everything is maximally absorbed where? In the PCT, DCT, loop of Henle or collecting duct. Answer is PCT. 100% of glucose and amino acid. Okay, 90% of phosphate and bicarbonate. 2 by third, 67% of sodium, chloride, water. So almost everything is maximally absorbed in the PCT. That is why mercury poisoning, you know, which is affected? PCT. Because almost everything is absorbed in the PCT. What about bicarbonate also? RAS mechanism is mainly regulated by, RAS means renin, which is released from JG cell. And I have told you which receptor is in the JG cell. Which receptor is present in the JG cell? We have discussed this. Yes, very good. Beta 1 receptor is in the JG cell. Very good, Praful. As well as in the heart. Excellent. Beta receptor, beta 1 receptor is in the JG cell. From 25 hydroxycholecalciferol, 125 is formed in, just now we discussed, in the PCT of kidney. Water is maximally reabsorbed in, almost everything is maximally reabsorbed where? PCT. Almost everything, 67% of water also reabsorbed in PCT. What to discuss here? Colipase is an enzyme found in saliva, bile, pancreatic juice or succus entericus. What is the answer? Yes, pancreatic juice. See, colipase is a protein required for optimal enzyme activity of the pancreatic lipase. It is secreted by the pancreas, okay? And succus entericus is an alkaline secretion produced by the gland in the wall of duodenum, consists of water and secreted by crypt of Lieber-Cohen. Both are MCQ in your FMG exam. So colipaste is a part of pancreatic life, pancreatic secretion. Parietal cells secrete, you know that, parietal and oxyntic, SCL. Function of secretin is, what is the function of secretin, doctor? Function of secretin is yes, increase gastric motility or decrease. Yes, Marathi Pratyusha. D. C. Function of secretin is it increase bicarbonate component, decrease gastrin, decrease gastric acid, increase contraction of pyloric sphincter. It increase bicarbonate secretion from the pancreas. Secretin is decreasing gastric acid secretion, motility, and increase the bicarbonate component of the pancreas. D-xylose absorption test is used to assess which of the following? It is a monosaccharide which should be absorbed. It is testing which? It is for malabsorption, like celiac disease. But now we have antibody test, so now we are not using this test. But for historical importance, they are asking this question, and answer is malabsorption due to celiac disease. Same question. All of the following are false about gastric juice secretion except. All of the following are false about gastric juice secretion except. Or which is correct? Cephalic phase is 20%, gastric phase is 70%, intestinal is 10%. So only this is correct. C. So no? The one liner for your only just for your revision purpose I am solving this. So remember that gastric secretion is when you are thinking about the food. Cephalic phase 20%. When food is in the stomach 70%. In the intestine 10%. So maximum is gastric phase. Repeat question again. Most sensitive taste secretion sensation is there's salt, bitter, sweet, umami, acid. Which is the most sensitive taste sensation? Which sensation is most sensitive taste sensation? Salt, bitter, sweet, umami. What is the answer? Yes, bitter. It can be poisonous also. That is why our tongue is most sensitive to the bitter taste. Very good. Delta cell of islet of Langerhans secrete what? Insulin is by beta cell. Glucagon is by alpha cell. Somatostatin is by delta cell. Simple. Chymotrypsinogen is activated into chymotrypsin by. See, trypsinogen is converted into trypsin by enterokinase. But chymotrypsinogen is converted into chymotrypsin by trypsin. So answer is trypsin. Remember, trypsinogen is converted into trypsin by enterokinase, but chymotrypsinogen is converted into chymotrypsin by. Okay. I think we are about to finish. Enterogastric reflex is stimulated by all except. When food is reaching in the enterum, it decreases gastric motility. When intestine is decreasing gastric motility, it is called as enterogastric reflex. So it is stimulated by all except. Yes, Trilok 79 question. Delta cell, no, it is absent. Numbering is wrong. There is no 79. Yes, Ankit Chaurasia, A. Very good. It is acidic content. Hyperosmolarity, distension of the duodenum. If acid is reaching, normally alkaline should reach in the intestine. Na? If acid is reaching, if acidic content is reaching, see, this is the answer. The degree of distension, the presence of any degree of irritation or pain, the degree of acidity or the osmolarity, these are initiating enterogastric. Very, very important. Enterogastric reflex. The reflex from the, it is a small reflex from the intestine to the stomach. It is inhibiting the gastric motility. How? If there is distension of the duodenum, if there is any irritation or the pain, if there is acidity, not alkalinity, or degree of osmolarity, all these are causing inhibition of gastric motility. Transporter of iron into enterocyte. Very, very, very important for FMG. Iron absorption. This topic is very important. Transporter of iron into enterocyte is by. This whole topic is very important. Time is very less, but a lot of topics are there. Ferroportin, transferrin, hepcidin, or divalent metal transporter. Abhimanyu, D. Full D. Very good. Answer is D. This topic is very important. Please listen very carefully. This whole topic. It will take only 2 minutes. Answer is D. See. Whatever food you are taking is in the form of ferric. They contain iron in the form of ferric. But it can be absorbed only in the form of ferrous. So first you have to convert ferric into ferrous by duodenal cytochrome B. Point number 1. Whatever food you are taking, all contain ferric ion, and it has to be converted into ferrous by duodenal cytochrome B. Point number 1. And point number 2, it is taken by intestine by divalent metal transport. This is the question. Question number 1. Ferrous ion is taken by intestine by DMT1. What is DMT1? Divalent metal transporter. Then this will come inside your intestine, duodenum. Now this ferrous will combine with apoferritin to become what? Ferritin. Remember, apoferritin when combines with this ferrous will form ferritin. And if deposit happen, then it form hemosiderin. That is different thing. Now, it can be transported to the blood by, what is this called as? Ferroportin. Remember, these are very, very important question. Ferroportin. To the blood circulation, and again this ferrous will be converted into ferric by hepcidin. Now remember, point number 1. Before absorption in the duodenum, ferrous should be in it should be in the form of ferrous. So ferric ion is converted into ferrous by what? Duodenal cytochrome B. Number 1. Number 2. How this ferrous can be absorbed in the duodenum? By divalent metal transporter. Then this ferrous will combine with apoferritin to become ferritin. And how this ferrous will go in the blood circulation? By a protein called as ferroportin. But this will go in the form of ferrous. But it will combine with transferrin only when it is converted into ferric by heptacin protein. These 6 protein are very, very important for your exam. I hope this is clear. All these proteins are clear. Once again, ferric is converted into ferrous by duodenal cytochrome B. Number 1. Number 2. This ferrous ion is taken inside duodenum by divalent metal transporter. This ferrous will combine with apoferritin to become ferritin. This ferritin, this ferrous can go in the blood circulation by which protein? The port. This port is called as ferroportin. But before combining with the transferrin, it need to be converted into ferric by a protein called as heptacin protein. Okay? This whole topic is very important. Iron absorption, 1-2 questions are definitely from your exam. It can be from physio, medicine, but topic is interlinked. Topics are interlinked. All are function of CCK except cholecystokinin except gallbladder contraction, contraction of sphincter of Oddi, pancreatic secretion, inhibit gastric emptying. All are function of CCK except. See, it inhibit gastric emptying. This is correct, Alam. It also contract gallbladder. This is also correct. See, if you want to release gallbladder, you will contract in sphincter or relax. Yes, very good. So, cholecystokinin is also inhibiting gastric emptying. Gallbladder contraction. Yes, you are correct now. Very good. Initiation of basic electric rhythm is by, interstitial cell of Kajal or Kajal, whatever you say. Basal electric rhythm, slow waves. These are also called as slow waves. The blood level of 125 dihydroxycholecalciferol is regulated by which hormone? We discussed this point. Which hormone regulate this formation of calcitriol? Which hormone regulate formation of calcitriol from 125 dihydroxycholecalciferol? Yes, very good. Shahib Pathan, parath hormone, Prafulgar also. All are correct. Good. Which act as a intracellular receptor? Thyroid hormone is working at the level of nucleus. This is the repeat question. Milk ejection is facilitated by oxytocin. You know that. Which of the following promote formation of growth hormone? Which of the following promote formation of growth hormone? Cortisol, REM sleep, glucose or glucagon. Growth hormone is increased by. Now this topic I don't know why. Every year they keep on asking the factor which increase growth hormone, the factor which decrease growth hormone. Only one answer is correct till date. अभी तक सिर्फ 2 आंसर करेक्ट हैं. Cortisol, my dear, decreases growth hormone. Stress increases growth hormone. First is wrong. REM sleep decreases growth hormone and REM increases growth hormone. Glucose decreases growth hormone. Hypoglycemia increases growth hormone. Glucagon and ghrelin hormone. These are the 2 hormones that promote growth hormone. Answer will be D. Every year they ask this question. Only lack of revision. See. Okay, so answer is D. Very good. So these all are decreasing growth hormone. Glucagon and ghrelin is increasing the growth hormone. Prolactin secretion is not stimulated by levodopa, sleep, estrogen, or pregnancy. Fast. Time is very less. I don't want to skip any question. Only few are left. See, dopamine is prolactin inhibitory hormone. So of course it will inhibit. Rest all will increase the prolactin hormone. Dopamine is prolactin inhibitory hormone. Answer is A. TSH produced by anterior pituitary. Very simple question. Nothing to discuss. True statement about melatonin are all except. Melatonin secreted by pituitary? No. Pineal? Yes. Associated with sleep mechanism? Yes. Can be used to treat jet lag? Yes. In jet lag, we used to give melatonin, agotonin. These are the salt which we used to give in the jet lag. So the wrong answer is A. True about capacitation are all except. Change that occur in sperm to penetrate ova? Yes. Occur in female genital tract? Yes. Occur in male? No. It happen after ejaculation when sperm goes in the female genital tract. Okay, so the wrong answer is B. Defect in the leptin. See, when you have a lot of fat releases leptin to inhibit the hunger. See, fatty people don't feel like eating. They always complain, साहब भूख नहीं लगती है, मैं ऐसे ही मोटा हूं, मुझे भूख नहीं लगती. क्यों? Because if you have excess fat, this will secrete leptin and this will decrease the hunger. And if there is defect in the leptin, it will cause obesity. So when we are obese, okay, we have less hunger. This is natural. But we keep on adding, spices and make it tasty and taking this liver syrup to increase the appetite. See, if we have excess fat, automatically hunger will be down. Automatically. Okay. GLUT receptor on the pancreas is, we have discussed GLUT2 was present in the beta cell, liver, intestine and the kidney. GLUT1 was in the blood-brain barrier, placenta, RBC. GLUT5 was for fructose. GLUT4 was for skeletal muscle and adipose tissue. It is the only GLUT that is insulin dependent. So many times GLUT and SGLT is asked. Insulin increases glucose uptake in where? Skeletal muscle and heart and adipose tissue. Okay. This is finished. Inhibin regulate what? FSH. Spin barket refers to cervical mucus. During ovulation, it become like egg white. It is called as spin barket refers to. Now the last question. Transpulmonary pressure is the difference between pressure in the alveoli, intra-alveolar pressure minus intrapleural pressure, is called as transpulmonary. Thank God I have finished 117 question and 20 question. 137 question has been discussed in a very short span of time. Because it was only revision, so I was very fast. My purpose was not to teach you something, but it is the last minute, so I tried to cover the fact. This much is clear. Now, any doubt you can ask me, or else we can end the session. Okay, I will share the PDF in the Telegram group. In my Telegram also, and if you want, I can share in this DocTutorial Telegram. I will share this PDF. I hope everyone is subscribed to DocTutorial Telegram. In the PDF, you will get more detail. Okay. Thanks a lot, everyone. And sorry for being fast because it was a revision session, so I have to. Yes, I will ask the team to share anatomy session also and YouTube. Okay. Thanks, Trilok. Thanks a lot. Okay, I will share that. I will share the link. Okay, so thank you. Bye bye. All the best. Thanks a lot. Of course, I will share. Yes, Shekhawat, receptor. For receptor, at least 2 or 3 hours is needed for receptor only. And I have to cover whole physiology in 2 hours. So receptor, I will take a separate lecture in that. Okay, I will share in the doc tutorial group itself. I will share the link. You can go from